At the moment, what I'm anticipating is that at some point in time, the number of cases will go up without any impact on admissions and severe disease. And when we get to that, what they call that safe equilibrium within an endemic phase, then we will be, that's where we want, that's where we're aiming for. Now, to achieve that safe equilibrium within an endemic phase, we do need the third booster dose, the first booster dose or the third dose. We need the coverage escalated. So right now we are up to 30% of the population that are qualified for having a booster being covered. I'm hoping that over the next few weeks we will start to escalate a lot more of our booster coverage. I do see some of our numbers in terms of cases. I see the numbers are creeping up a little bit, and I've mentioned that I've mentioned it in the statement last night. But I really believe that we should not panic. That all we need to do is just focus on getting the booster dose coverage up, getting everybody protected, and we will basically just break the connection between case and admission. If we can break the connection between case and severe disease, then we are achieving a safe level of endemic disease. Yeah, I think what's happening now is that now we've got everybody a little bit more re-energized to come in. We've focused a lot of effort on our frontliners, that is right at the international airports and all the ports. I think on the weekend, the staff tried to establish a small center up in the supermarket as a pilot process, just to see if what's the traction they can get there. We do need to start highlighting a little bit more comms to support our booster dose program, and I think probably we're now at a better stage now that everybody's had enough time to quieten down and reflect and get their socioeconomic issues more stable. Now we can try to get people just to think a little bit more clearly and start working on protecting themselves for the long term. And the third dose is about protecting yourselves for the long term. I've given a lot of instructions on how we can use masks wisely. And I think moving forward, we are going to have to navigate this COVID world a little bit more intelligently. And especially when you know that not only COVID is around, you've got, again, monkeypox shares some of the characteristics of COVID. And the good thing about vaccinations is that they tend to slow transmission throughout the community. So when they slow transmission, it makes our action, like we don't have to go running around doing lockdowns or doing any big major socio-economically damaging public health measures. We are able to just do things in a quieter and controlled manner and proportionate to the size of the problem.